We have 22 live data feeds that are all separate and distinct, and a physician can log in to one place and get the data they need, regardless of whether it came from a hospital lab, whether it came from an independent reference lab, whether the radiology came from hospital department 1 or from competitive hospital number 2, or if they're looking for discharge summary from a hospital that the patient saw 2 months ago and now they're admitting the patient to a different hospital. That ability to go to one place to get the data has been a key component of physician adoption. It simplifies their lives.
Since we started using Axolotl, we've grown from about 10,000 clinical messages per month to about 23,000 messages per month now. Part of that is due to the growth that we've had within our Franciscan medical group, but the other part is just growth in visits that we've had from our community physicians. One of the reasons that physicians like to refer patients to our hospital is because that they know that they're going to get those results back as soon as the tests are completed. So I think a lot of that has driven the volume into the hospitals.
Over the last 5 years in Santa Cruz, we've seen a dramatic increase in adoption. Our numbers have gone up more than fivefold in the last 5 years to well over 1 million page views a month. And each page view is a clinical document viewed or processed by a clinician.
To have 85% of the providers in our county connected electronically with less than 24 months has astounded some folks.
We've been really working on doing the data interfaces, getting the data to flow. And one of the things that they're very good at is understanding doing just enough to get the biggest bang. So in one of those examples is they do link mapping, which is essentially a way of saying, hey, I know what this lab information means and I can take lab results from different places. And they've figured out how much to do, but not to do too much. So a lot of times it's more important to know what not to do than to know what to do. And they have a precision with that we feel like is based upon some deep experience.
As of a survey a year ago, 98% of our physicians are using Elysium in some fashion in our community.
We expect to achieve something very close to 95% or more of physicians connected. The demand exceeds our ability to supply, which is a nice problem to have.
Physicians Medical Group's been the longest time customer of Axolotl, and over the last 12 years we've been using the system and been using it pretty much to its fullest extent. We use the referral, the authorization piece, the lab ordering and lab receipt, e-prescribing, and now SureScripts, transcription. So we utilize the system to a very great extent, and that's because of its ease of use and secure access from anywhere, and also it's a very good value for our physicians.